These are the three most common mistakes I see patients make after having hip replacement that increase their pain but ultimately slow their recovery. The first mistake that people often make is they try to do too much too soon. Specifically, they try to stand or walk way too much and way too early. So, for example, first thing in the morning, typically you might be feeling a little stiff, but then as you get going throughout your morning, you're moving, you're doing some of your home exercise program, you're doing your exercises, you're going to feel a little bit better in terms of that pain relief. However, while you're feeling less symptoms, what often I'll see is people will say, oh, I wanted to try cooking a meal, and they'll end up standing for 15 plus minutes. However, that hip is still healing a lot, and standing for even 5 minutes is a long time without unloading or taking some of the weight off of that hip. So after they stand and cook for 15, 20 minutes, later on that day or even that night, they'll report and say that they're having a lot more pain, a lot more swelling, all because they felt good earlier in the day and they thought they could do a lot more in terms of their standing activities. However, our goal really that first week especially is to, one, when you're getting up, you're changing position and you're standing and walking, you're only doing that for about a minute, maybe two. You're just trying to go from the bedroom to the kitchen or from the living room to the bathroom and back. So everything is very short distance. So you're spending less time standing, so less weight on your hip. However, if you try to stand for 15 plus minutes, that's a lot of weight bearing on that surgical hip that it's just not ready for because it's still healing. So standing and walking way too much too soon is one of the most common mistakes that I'll see that'll cause a lot of pain, and ultimately that'll increase how much swelling and edema that you have, which will slow down your recovery. Another common mistake after hip surgery is patients will try to remove the outer bandage or outer dressing way too soon. So when you want to remove that is going to depend on your orthopedic surgeon. Every surgeon is going to have a little bit of a different timeline in terms of when they want you to remove that dressing. However, typically, most surgeons will have you wait until that 7 day or 7 to 10 day mark before you remove the outer dressing. You usually don't want to remove it before that. So if you remove it before that, a little too soon or too early, what happens is now if you try to bathe or clean that area and you get a little bit too much water, that can affect the incision and some of the healing that's occurring. You don't want to get that area like soaked, too wet, because that dressing is supposed to stay on there a little bit longer to prevent too much moisture getting to that area so the skin and tissue can actually heal. So usually you want to wait at least 7 to 10 days before you move the outer dressing. But again, go by your orthopedic surgeon's protocol in terms of when they want you to remove that dressing. So don't remove it too soon. A third common mistake that I often see people make, so regardless if you had an anterior or posterior approach, when you try to stand up from a sitting position, whether that's from the bed or from like your couch or recliner chair, what happens is a lot of times people will bend way too forward when they try to stand up. Instead, you should, your PT will go over how to correctly do a transfer, but essentially that surgical leg, you're going to straighten that leg out, and then you're going to be using your arms and your opposite or non-surgical leg to help you stand a little bit more, and you're not using your surgical leg as much to push off from the floor. But a lot of times people make the mistake of bending too far forward at their hip versus you should be a little bit more upright with a little bend, but you don't want to bend too excessive. So with the posterior approach, you definitely don't want to bend because that's one of the contraindications or that's one of the precautions that you want to make sure you don't do that movement because you don't want to have the possibility of dislocation for that posterior approach for the hip replacement. You also want to allow that incision to heal properly. So if you're bending too much and you had the incision on the back side of your hip, that's going to cause a little bit too much tension and stretch out that soft tissue in the skin that's trying to close and heal. But even if you had an anterior approach, if you do very excessive bending as you try to stand up, that can put a little bit of compression or a little bit too much discomfort or pressure on the anterior structures of your hip. So regardless of anterior or posterior approach, you just want to avoid doing too much bending as you try to stand up. So kicking out that surgical leg, keeping that knee straight the whole time, and then just trying to keep your torso a little bit more straight and upright as you stand, using your arms and your opposite leg to help you get up. If you want to learn more about what exercises to do after hip replacement surgery, watch this next video.